there is a lot more thought put into how people interact with the diagnostics and then also what you do with that data. The data needs to be really easy to interpret.
Hey Joris, I noticed on my calendar here that July 23rd, I'm going to be doing a LinkedIn Live episode talking about the future of remote diagnostics. And I thought I would take this opportunity to see what your thoughts are on the future of remote diagnostics. A little bit of prep work.
There you go. Thanks, Nick. That's a good question. So remote diagnostics is really an area that's growing. We see a lot more devices and a lot more clients approaching us that want to make devices in that space. So maybe I start by saying that we're dealing currently with an aging population. We're dealing with a healthcare system that is getting more and more expensive, and a lot of pressure to make it less expensive. Hospitals that are full. So what we see as a general trend is that we want to keep patients home for longer, and people in their homes for longer. So what enables that is really things like remote patient monitoring and home diagnostics. And that's exactly where remote diagnostics come in. So a lot of these devices that are being developed for people to be used at home or in a clinic are used outside of a hospital. And sometimes it can mean people that were previously in a hospital had to be monitored every day are now living at home and can be monitored by their partner or by a nurse that comes to visit every day.
Right. Yeah, and it certainly does two things in my mind. One is it reduces that burden on the healthcare system, so one person not taking up a bed, they can be at home, ambulatory, and actually have agency over the data that's coming out of there. And then the other thing too, if we think about, just coming out of the pandemic, we have the healthcare system is overwhelmed. You want to keep people out of congregating areas, and so having that remote capability kind of integrated now, I think is a huge advantage. One of the things, though, that I find that's interesting, at least from an engineering perspective, and this is sort of some of the talk I'll be giving on July 23rd, and that is the human factors, right? Like how taking, for example, if we think about diagnostics in a hospital, a blood draw, right? That's kind of a complicated thing. I know I'm not really comfortable taking blood from myself. You need to have a phlebotomist come in, have the sample being prepared in a certain way and getting it back to a central lab. The technologies around making that type of diagnostic system transferable to a remote setting in a safe and human factors efficient way, if I can use that word, I think is the really exciting engineering challenge, and why I'm really excited about the future of remote diagnostics.
Yeah, I think that's absolutely, you hit the nail on the head there. A lot of things that are done typically every day in a hospital by trained professionals now have to be done by people that are less trained, or maybe even without training. So things like a blood draw is a good example of something that needs to be really rethought. Can we do that in a different way so that somebody can do it at home? And just in general, the interaction with the diagnostic equipment, right? We have seen Apple putting out watches with integrated ECG monitors. We now see glucose monitors that interact with the phone and give people that information. So there is a lot more thought put into how people interact with the diagnostics and then also what you do with that data. The data needs to be really easy to interpret, because before you know it, people get maybe a data point that's outside the ordinary, which is maybe of no concern, but there's now no doctor to interpret that data point, right? So we need to think about that.
Well, that's an interesting point too, because then it almost drives the reverse of the whole point of remote diagnostics. That's deburdening the healthcare system. And so if you've got, me wearing my watch saying, oh my gosh, my EEG is all over the map here, but it really says the watch has moved around or something. Exactly. And now I'm burdening the healthcare system with all these complaints. So that's an interesting thing. Yeah. The other point to the data that you mentioned is protecting that data, right? You always get these notifications on your phone now, and the phone's always ringing with spam emails and that sort of thing. Imagine now having your health information going out, and how do we protect that information? That's another really exciting development that's going to be happening with the future of remote diagnostics.
Yeah, absolutely. So the future of remote diagnostics, you can really think of it's mostly centered around human factors and how you interact, data and diagnostics, and then how to have actionable data and have that data be meaningful to somebody that actually learns about that data, so like a user themselves or a nurse.
Absolutely. Well, thanks very much, Joris, for talking about that. I'll take those notes and we'll talk about that on July 23rd. There's the LinkedIn Live that'll be coming to you on LinkedIn. That's another episode of BioBreak. Have a great day.